In Tanzania, on the east coast of Africa at the White Sands Hotel, the South African-based Center for Justice and Crime Prevention brought together a diverse group of people to share knowledge and experience on preventing youth violence.
Thank you and welcome. I guess it's my job to welcome you all here this morning and to thank you all for coming. The CJCP, the Center for Justice and Crime Prevention, is an NGO that's based in Cape Town, South Africa, but we do work in the region. We work with a range of partners. When we first started discussing this event with the Open Society as our main partner in this, was really to bring together a combination of researchers, practitioners, policymakers, all who worked in the broad field of violence prevention with a specific focus on children and youth. We have 25 different countries represented here. It's a very diverse group, and I think that there's a lot of sharing and learning. We always put a lot of emphasis on context and how important context is to the violence prevention work that we do, rather than just trying to transplant what works in one environment to another environment. And in doing so, we often lose sight of some of the commonalities and the shared challenges that we do face. And so I think it's about striking a balance. And with the group of people that we have in the room, I anticipate and I hope that we're going to really have a very open and sharing discussion.
Day one heads straight into the importance of research and understanding the nature of violence.
My ministry launched the National Report on the Violence Against Children report in Tanzania, which revealed that violence against children in Tanzania is a serious human rights issue as well as a social and public health issue.
For developing a coherent response, you need to know who's committing the violence, who's responsible for that. And I think unsurprisingly for any of us, who've worked in this field, this is not dominated by strangers. This is not dominated. The violence is not dominated by people who don't know the kid. You can see stranger up there. Yes, it's a reasonably high score. But just put the others all together, and these are the people that are in the kid's life day in, day out. Authority figures is teachers, is more or less all teachers. You don't see that on the slide, but when they were asked about authority figures, there were different options like judges, police, teachers, religious leaders. Teacher was the highest scorer. Nearly 50% of the girls, 50%, had never spoken to about this to anybody before. And over 2/3 of the boys had never spoken about that to anybody. Not until somebody came to their house and asked them a specific question. Of those who had actually told somebody, how many of them sought help? The number goes down. 11% of the boys, 22% of the girls. This is why we needed to do something. The prevalence was high, but children's confidence to report was very low. Why do you want to put a child helpline in place? Because children need a confidential reporting mechanism. They don't trust. Why should they? Why do you want to set up gender and children's desks with the police? Because they need police officers that are sensitive to children, not the normal ones. And so all of those response measures, they directly relate to the evidence. You see, Tanzania, like many other governments globally, is facing financial constraints. Fiscal space is tight. But the argument is that if you provide an early response to children at risk of violence, or you provide prevention measures, you're going to save money down the line.
The keynote speaker, a two-term mayor of Bogota, Colombia, discusses his experience on the coexistence between law, morals and culture, and their importance in addressing violence.
Just why we behave as we behave. A little exercise. Who would choose admiration for the law? Nobody? In Colombia also people laugh a little bit.
The World Health Organization's Department of Violence, Injury Prevention and Disability spoke about the importance of early intervention.
Prevent youth violence, starting from home visitation programs for pregnant mothers, continuing with early childhood development programs, parenting programs for parents with toddlers or very small children, programs for children in preschool age, for children at the primary school age, for youth in secondary school, for those who never visited a school, because there's also a substantial number, or those who dropped out of school, so high-risk groups, and for young adults. And we look at all these interventions with the perspective of reducing youth violence.
The role of data and evidence assists the Tanzanian Department of Health to identify possible solutions. The government of Trinidad and Tobago has spent $2.6 billion on free education.
The biggest challenge we have in our country right now is crime.
Research highlighted the importance of community intervention over simple financial expenditure.
It was done through community mobilization. It was important to know the history of the community, the challenges and needs, and then just to know what other people are working in the community. We formed community action councils, which are groups of committed people in the community. We did rapid impact projects, and all these strategies we embarked on in these 22 communities.
Possible controversial methods were used to successfully gain youth participation.
Their members. In my country, when you go into a community that has a strong gang and you want to work with the young men, you have to talk to the gang leader. I mean, you have to know how to do it, but you basically say, that you want these young people to participate in the program, and what do you think about it?
Kelly, really what you've demonstrated to us is you cannot solve problems by throwing money at them. I think you really have to understand the context. You have to come at things from a range of different angles, and so I think making assumptions about what works is dangerous.
Day one's afternoon session, Gender and Violence Prevention, highlights the need to work with men and boys.
My name is Pierrette Fengeradi Sonka Joyce. Not long, it's short. There is this negative conception of masculinity. What is a real man? What a man can do to show that he is a man enough. So this conception leads to higher level of domestic and sexual violence. As a man, I'm the one who have to determine when and where to have sex. As a man, I'm the only one to say we are going to use condom or not.
One speaker highlights the need for empowerment of girls in Africa to overcome a unique and common form of violence, and on the gap between legislation and practice.
We are approaching the FGM season in Mara region of Tanzania, and that's why a very narrow topic, just so that we can have a very focused discussion on what you feel is the best advice for us to proceed in protecting as many girls as possible. The demographic and health surveys that get periodically done indicate that the prevalence in Tanzania has stayed the same between the survey of 2004 and 2010. There has been absolutely no improvement in the prevalence, and that despite there being legislation against FGM. It was already enacted in 1998. In Tarime, during the last FGM season, 8 girls died during the mutilation period. It's been illegal since 1998. We have the commitment of all the local authorities and the central government. What can we do to actually change the situation so that those 4,000 girls who are going to be cut this December don't get cut? Thank you.